When a zoonotic coronavirus spreads from the respiratory system, your liver is often one downstream organ that suffers. Doctors have seen indications of liver injury with SARS, MERS, and COVID-19, often mild, though more severe cases have led to severe liver damage and even liver failure. So what's going on? Once a virus gets into your bloodstream, they can swim to any part of your body. The liver is a very vascular organ, so any kind of virus can very easily get into your liver. Your liver works pretty hard to make sure your body can function properly. Its main job is to process your blood after it leaves the stomach, filtering out the toxins and creating nutrients your body can use. It also makes the bile that helps your small intestine break down fats. Your liver also contains enzymes which can help speed up chemical reactions in your body. Don't forget to like, share, and subscribe to the channel. And if you like those videos, please ring that bell. In a normal body, liver cells are constantly drying off and releasing enzymes into your bloodstream. This resourceful organ then quickly regenerates new cells and carries on with its day. Because of that regeneration process, the liver can withstand a lot of injury. When you have abnormally high levels of enzymes in your blood, as has been a common characteristic of patients suffering from SARS and MERS, it is a warning sign. It might be a mild injury that the liver will quickly bounce back from, or it could be something more severe, even liver failure. Scientists don't completely understand how these respiratory viruses behave in the liver. The virus might be directly infecting the liver, replicating and killing off the cells itself, or those cells might be collateral damage as your body's immune response to the virus sets off a severe inflammatory reaction in the liver. Either way, that liver failure was never the sole cause of death for SARS patients. By the time the liver fails, oftentimes you'll find that the patient not only has lung problems and liver problems, but they may also have kidney problems. By then, it becomes a systemic infection. Yes, your kidneys are caught up in this mess too. 6% of SARS patients and a full quarter of MERS patients suffered acute renal injury. Studies have shown that the novel coronavirus can do the same. It may be a relatively uncommon feature of the disease, but it is a fatal one. Ultimately, 91% of SARS patients with acute renal impairment died, according to a 2005 study in Kidney International. Like the liver, your kidneys act as a filter to your blood. Each kidney is filled with about 800,000 of microscopic distilling units called nephrons. These nephrons have two main components, a filter to clean the blood and a little tube that return the good stuff back to your body, or send the waste down to your bladder as urine. It's the kidney tubules that seem to be most affected by these zoonotic coronaviruses. After the SARS outbreak, the World Health Organization reported that the virus was found in kidney tubules, which can become inflamed. It's uncommon to detect a virus in the tubules if it's in your bloodstream, as your kidneys are continuously filtering blood. Sometimes the tubular cells can trap the virus and cause a milder injury. That injury could become lethal if the virus penetrates the cells and begins to replicate. Acute kidney injury in SARS patients might be due to a diverse set of causes, including low blood pressure, sepsis, drugs, or a metabolic disturbance. Acute renal failure can also sometimes be brought on by antibiotics, multi-organ failure, or being connected to a ventilator for too long. Everything is connected in the human body. So, that's what the COVID-19 virus does to the human body. Thank you for watching another episode of Endless Info.